Our last presentation in this first session then is by Lauren Arrigoni. Lauren is a nurse practitioner who works as part of the PICOS PASC study at Children's, and she's going to talk to us about her work using a webinar to improve COVID-19 vaccine hesitancy. Lauren, all yours.
I'm Lauren, and I'm a pediatric nurse practitioner for the Pediatric COVID Outcomes Study at Children's National with Dr. DiBiase and Dr. Montalegre. And then my outside of work project was this project, which is a webinar to improve COVID vaccine hesitancy for my Doctor of Nursing practice at Penn. And this is actually a screenshot of the webinar that's still live on YouTube at the Children's National YouTube page if you want to view it or share it with any friends that have some vaccine questions. So our project examined if a webinar for parents could improve parental COVID vaccine hesitancy. Unfortunately, there have been 738 pediatric deaths from COVID, and there are several reasons why a parent might be vaccine hesitant. In a national survey, about 54% of parents were hesitant to give their child the COVID vaccine. And for this project, we did a literature review of childhood vaccine hesitancy research. And prior digital interventions included webinars, video games, social media, and others. So a webinar was chosen for this project due to the time constraint of the DNP curriculum. In March, we hosted a 1-hour webinar with 3 Children's National providers, including Dr. Yance was one of the speakers, and allowed parents to ask questions to the vaccine experts. Our experts included a leader for the pediatric Pfizer COVID vaccine trial, an infectious disease physician, and the medical director for COVID vaccines, who served as site lead for this project. We utilized an adapted, validated survey called the Parental Attitudes About Childhood Vaccine Survey, or the PACV. And the survey had minor word adjustments to reflect COVID vaccines rather than general childhood vaccines. The survey was first created by Dr. Opel out of Seattle Children's Hospital in 2011, and since then has been used widely in childhood vaccine hesitancy research, and more recently adapted for COVID-19 parental vaccine hesitancy research. For the live webinar, we had about 29 participants, and then we posted the webinar to YouTube where we had much more traffic. We had over 1,300 views on YouTube, and we initially received 400 surveys, but for the purposes of this analysis, only matching pre-post surveys were included, as well as surveys that had that hour time frame since it was an hour webinar. So we didn't include surveys that were submitted shorter than the hour. I pulled some of the interesting questions from the survey results, and you can see here how many participants reported worrying about vaccine safety and how many parents felt like they could not discuss their concerns with their child's doctor. In fact, over half the participants responded that they seek vaccine information from social media and the internet. We did find a statistically significant improvement in vaccine hesitancy scores, which improved by 11.5 points, the median. Some of the questions we received from parents included, will the vaccine affect growth hormone for children, which we could answer in real time with a scientifically based answer. What are the long-term side effects of the vaccine? And when will the vaccine be approved for 5 years and under? The webinar was advertised on Facebook and Instagram, and at the end of the webinar, 2 parents did change their vaccine intentions from I do not intend to give the COVID vaccine to I do now intend to give the COVID vaccine. In the future, I'd love to track actual vaccination rates, but again, we weren't able to track that quite yet for the purposes of this project. In conclusion, we were able to provide a scientific-based vaccine research for parents and did improve vaccine hesitancy as measured by the survey. As a part of the webinar, we also discussed how parents can empower their peers and start vaccine conversations with other parents. And most importantly, vaccine hesitancy outreach can begin early, even before the vaccine is available. What we're learning now about COVID vaccine hesitancy, we can apply to future public health issues or pandemics. And my hope is for the next webinar is to actually do it all in Spanish. The PACV survey is available in Spanish. So that would be the next step after this project that I'd love to do. I also wanted to thank the Infectious Disease Department at Children's National and the Nursing Research Department for the funding for the project to help advertise on social media to tell more people about the webinar. Thank you so much.